if I told you that pancreatic cancer doesn't actually appear out of nowhere? That the body sends signals, sometimes as much as 2 full years before a diagnosis is ever made? And what if I told you that most of those signals get dismissed as something ordinary, as aging, as stress, as something you ate? What if the difference between catching this early and catching it too late came down to knowing exactly what to look for? That's what this video is about. And I want you to stay with me because the third sign on this list is the one that surprises people most, including doctors who've been in practice for decades. I'm Dr. Mark, and on this channel, I take the most important findings in cancer research and translate them into clear, actionable information for people who want to stay ahead of their health, especially those of us in our 50s, 60s, and 70s, when this kind of awareness matters most. Here's the truth that doesn't get said enough. Pancreatic cancer has one of the lowest survival rates of any major cancer, not because it's impossible to treat early, but because it almost never gets found early. Most diagnoses happen at stage 3 or 4, when options are limited. But the biology of this disease means the body is quietly signaling long before that. Before I go further, drop a comment below and tell me 2 things: how old you are, and whether you or someone you love has a history of diabetes or digestive issues. I read these comments and they help me understand exactly who I'm talking to. In 2022, researchers publishing in the journal Cancer Epidemiology, Biomarkers and Prevention analyzed health records from over 10,000 patients and found that a cluster of seemingly unrelated symptoms began appearing in patients an average of 24 months before their pancreatic cancer diagnosis. To put that in perspective, 2 years is a window, a genuine window, and most of those patients had seen a doctor during that window without anyone connecting the dots. Today, I'm going to walk you through 3 of those early signals, backed by population studies and clinical research, moving from the most commonly overlooked to the one that researchers now consider the most diagnostically significant. Number 3 is the sign that, when it appears in a specific combination, raises red flags at the highest levels of oncology. Stay with me through all 3, because it's the pattern that matters, not any single symptom on its own. New-onset diabetes after 50 is not just a metabolic problem. It may be a message. Here's what I mean. Most people understand diabetes as a disease of lifestyle, diet, weight, genetics, inactivity. And that's true for the vast majority of cases. But there's a subset of people who develop type 2 diabetes suddenly, after 50, with no obvious risk factors, and in a meaningful percentage of those cases, something else is happening. The pancreas isn't just struggling to regulate blood sugar because of lifestyle, it's being disrupted from the inside. The pancreas does 2 jobs. It produces digestive enzymes and it produces insulin. When a tumor begins growing in the pancreatic tissue, even a very small one, it can interfere with insulin-producing cells before it causes any pain, any visible mass, or any other obvious sign of disease. In 2018, a landmark paper in the journal Gut followed patients who had been diagnosed with new-onset diabetes over age 50 and tracked them for 5 years. They found that roughly 1 in 100 of those new diabetics were subsequently diagnosed with pancreatic cancer within 3 years, a rate approximately 8 times higher than the background population. To put that in perspective, that's not a small statistical blip. That's a signal strong enough that the American Cancer Society now recommends clinicians take a closer look when diabetes appears suddenly in older adults with no prior risk. Picture a composite of the patients in those studies. A 64-year-old man, healthy weight, no family history of diabetes, who went in for a routine blood panel and came back with a fasting glucose of 180. His doctor started him on metformin. His blood sugar didn't respond the way it should have. 6 months later, a scan revealed a small tumor in the head of the pancreas. Still resectable, still treatable. The diabetes wasn't a coincidence. It was the first signal. After 55, your baseline pancreatic function naturally begins to decline. The tissue is less resilient, and any additional disruption from a growing tumor is felt earlier in the metabolic system. This sign targets exactly that window. What to do with this information? If you or someone you know develops type 2 diabetes after the age of 50 with no clear lifestyle explanation, and especially if blood sugar is difficult to control on standard medications, ask your doctor specifically about pancreatic imaging. A simple question: given my age and the sudden onset, should we take a look at the pancreas? That question could open a conversation that changes everything. Synergy note for later. This sign becomes significantly more meaningful when it appears alongside the second sign. Keep that in mind as we move forward. But the second sign is one that almost every person over 55 has experienced, and almost no one takes seriously. Let's talk about what makes it different. Unexplained weight loss sounds like something dramatic. It's not. That's exactly what makes it dangerous. We're not talking about losing 40 pounds in a month. We're talking about a slow, quiet, unintentional loss, 5, 8, 10 pounds over the course of several months, without any change in diet, without trying, and often without even noticing at first because it happens so gradually. The mechanism here is specific. Pancreatic tumors disrupt the production of digestive enzymes. When those enzymes are reduced or blocked, the body can no longer absorb nutrients from food efficiently, even when the person is eating normally. Calories go in, the body can't extract them properly. Weight drops, muscle begins to break down, and because there's no pain, no nausea, no obvious reason for it, people chalk it up to aging, or to eating a little less, or to stress. In 2020, researchers at Johns Hopkins reviewed pre-diagnosis records of 2,500 pancreatic cancer patients and found that unintentional weight loss was present in 67% of patients during the 12 to 24-month window before their formal diagnosis. 67%. And in the majority of cases, it had been noted in a medical chart, but never acted on as a standalone warning sign. Picture a composite from those records. A 61-year-old woman, active, healthy eater, who noticed her clothes fitting looser over the summer. She lost about 9 pounds without trying. She wasn't unhappy about it, assumed she'd just been more active. Her appetite was slightly reduced, but nothing alarming. By the time an unrelated CT scan picked up a mass on her pancreas 14 months later, she was down 16 pounds total. After 60, some degree of muscle loss is expected. That's why this sign gets buried in the noise of normal aging. But normal age-related weight loss is very slow, typically less than 1 pound per year of lean muscle mass. If you're losing meaningful weight without a clear cause over a period of weeks or months, that is not aging. That is a signal worth investigating. Practically speaking, weigh yourself consistently, not obsessively, but monthly. If you notice a drop of more than 5 pounds over 2 to 3 months and nothing in your life explains it, no change in eating, no new exercise regimen, no illness, bring it to your doctor. Ask for labs that check your nutritional absorption, and don't let it get filed away as probably nothing. Synergy. When unexplained weight loss appears alongside new-onset diabetes, the two findings together raise the statistical likelihood of pancreatic involvement dramatically. This is the combination that should trigger imaging. Neither sign alone is definitive. Together, they form a pattern. And the third sign, the one that surprises even experienced clinicians, involves a change that most people assume has nothing to do with the pancreas at all. It has to do with the color of your skin, and what it means will change the way you think about this disease forever. Jaundice is not subtle when it's severe, but in its earliest form, it absolutely is. Most people associate jaundice with a dramatic yellowing of the skin, something you'd notice immediately, something obviously wrong. And yes, advanced jaundice looks like that. But early jaundice, the kind that appears months before diagnosis, often presents as a slight yellowing of the whites of the eyes, a subtle warmth in the skin tone, urine that turns a darker yellow or amber color, Stools that become unusually pale, almost clay-colored, without explanation. Here's the biology. The pancreas sits directly adjacent to the bile duct, the tube that carries bile from the liver into the digestive tract. When a tumor grows in the head of the pancreas, even a small one, it can compress or partially block that bile duct. Bile backs up into the bloodstream, and the first place you see it is in the eyes, the sclera, the white part, and in the color of urine and stool. This is called obstructive jaundice, and it is one of the most diagnostically significant early findings in pancreatic cancer. In 2021, a study published in the Lancet Oncology analyzing 4,800 cases found that patients who presented with early obstructive jaundice were 3 times more likely to be diagnosed at a resectable stage, meaning a stage where surgery is still possible, than patients who came in with pain or weight loss alone. 3 times more likely. Because when the bile duct is compressed, you get a symptom that can be seen, and if someone is looking for it, they can act. Picture the composite patient here, a 68-year-old retired teacher who noticed his wife commenting that his eyes looked a little yellow. He brushed it off for a week. Then his urine darkened. He assumed he wasn't drinking enough water. But when his stool turned pale, almost whitish, he called his doctor. An ultrasound the following week found a 2-centimeter mass at the head of the pancreas. He was in surgery 4 weeks later. After 60, we rarely look at our own eyes closely. We don't inspect our stool. We don't think of urine color as clinically meaningful beyond hydration. But these small, overlooked changes are the body's most direct way of signaling that something is compressing the biliary system, and the pancreas is the most common culprit when this triad appears together. Practical action. Make a habit of glancing at the whites of your eyes. Check in with your body. If you notice persistent dark urine that doesn't resolve with hydration after a full day of drinking water, take note. If your stool becomes pale or clay-colored without an obvious dietary reason, that is worth a same-week call to your doctor. Not an emergency room, a call, a scan, an answer. And when this sign appears alongside the first two, new-onset diabetes and unexplained weight loss, you have the clinical triad that researchers now consider one of the most predictive early patterns in pancreatic cancer detection. Let's run through all 3 before you go, fastest to most significant. New-onset diabetes after 50 with no clear lifestyle cause, especially when blood sugar is hard to control, may reflect tumor disruption of insulin-producing cells and carries an 8-fold increase in pancreatic cancer risk compared to the general population. Unexplained weight loss of 5 or more pounds over 2 to 3 months without dietary change, present in 67% of patients in the pre-diagnosis window, signals disrupted enzyme production and nutrient absorption that no amount of eating can fix. Early obstructive jaundice, yellowing of the whites of the eyes, dark urine, pale stools, caused by bile duct compression from a growing tumor at the head of the pancreas, and the sign most associated with catching the disease while surgery is still an option. Here's the message I want you to carry out of this video. Pancreatic cancer has a reputation for being untreatable. That reputation was built on late-stage diagnoses. It was not built on early detection. The research is clear. When this disease is found early, survival rates climb dramatically. And early detection starts with people like you, knowing what to look for and refusing to accept probably nothing as an answer when your body is telling you otherwise. Change is possible at any age, 60, 70, 80. The biology of early detection has no age limit, and neither do you. 2 questions for the comments. Which of these 3 signs are you going to watch for first? And what's your single biggest challenge when it comes to getting doctors to take your symptoms seriously? Your answers might shape exactly what I cover next. If this video gave you something useful, and I hope it did, do 3 quick things. Hit like so this reaches people who need it. Subscribe so you don't miss what's coming next. And share this with someone you love who's in their 50s or 60s and deserves to have this information. One final note. The signs I've described today are backed by real research, and exactly because of that, they carry weight in a clinical conversation. If anything here resonated, if you recognize one of these patterns in yourself or someone close to you, please bring this to your doctor before drawing any conclusions. Some of these signs interact with medications, particularly diabetes medications and blood thinners. Your doctor needs the full picture. This video is information. Your physician is your partner. Use both.